like to welcome everybody to today's Medicare training. The last part of Medicare that really kind of completes the puzzle here is that supplemental or that Medigap coverage. And what we're going to really briefly talk about here is kind of what the Medicare supplement is. We're going to go over the NatGen's plan designs. We're going to go over how to enroll utilizing the NatGen sign, and then what you really kind of can expect post-sale. So as I was talking earlier, Medicare supplements really kind of sell themselves. You know, it's really going to take care of all those co-payments, co-insurance, and deductibles that the enrollee is going to have that original Medicare doesn't cover. And what that really does is it kind of gives them the peace of mind that they can focus on getting well. As I've mentioned before in prior webinars, you know, really the mental aspect of healing, it's a really big piece of the puzzle on getting well, right? So if you have a positive frame of mind to allow you to focus just on getting well and the fact that you have that protection against all those out-of-pocket costs that they could potentially be there, that's really going to accelerate and help their overall process of getting well, right? They can actually go to see any doctor or hospital that accepts Medicare, so they have that flexibility, and there's really no waiting period on this whatsoever as well either. It actually will start the first of the month of the following month. Now, some things to keep in mind though is that there is no standalone coverage on the supplemental side. It's not really its own insurance. They do have to already be enrolled in Medicare Parts A and B. So if you remember that chart when we were looking at the differences between original Medicare and Medicare supplements, if you sign up for a Medicare Advantage plan, you're not going to get supplemental insurance. It's something that does require original Medicare, so you have to have your Parts A and B. There's no drug benefits, no vision, dental, hearing aids, things of that nature, and it doesn't duplicate any sort of a benefit already being paid by Medicare. So it really just does what it says it does. It's going to be supplemental insurance to cover those gaps in your insurance for those things like your co-insurance and your co-pays. Now, there is a 12-month rate guarantee for the first year. To remember though, after that first year, the premium might increase, but we're never going to change that premium unless we do so for a policy, you know, in your state on a class basis. A benefit period does start the day they go into the hospital or skilled nursing facility and then ends when they haven't received any sort of care for 60 consecutive days. Eligible expenses are deemed to be costs medically necessary by Medicare, of course, and covered expenses under the plan. So just some of the terms and conditions in regards to this specific NatGen policy. Now, some of the nice things about this, if you take a look at the plan chart here. So just like I mentioned, this plan is going to take care of all of those gaps in your original Medicare coverage. So once your Part A deductible comes into play, when you first go into the hospital, that $1,340, or let's say, for example, that you stay in the hospital for over 60 days or over 90 days, those amounts per day of the $335 per day or the $670 per day, those are all going to be covered under that gap plan. And again, likewise on the blood side of things, you know, those first 3 pints of blood that original Medicare didn't cover, this plan is going to also cover as well. So again, you know, this plan really kind of sells itself as far as whether it's inpatient care or skilled nursing care or even outpatient medical coverage. It's really going to take care of those gaps in the plan that the original Medicare is not going to cover. So again, it really does give you that peace of mind to not have to worry about any sort of amount that you're going to have to pay out of pocket, and you can just focus on getting well. Now, something nice about this though, as far as an additional benefit, is that let's say, for example, that they're traveling, you know, anybody over the age 65, if they're retired, so a lot of individuals like to travel a lot, right? So if they are outside the United States, they're first going to have to pay a $250 deductible for every calendar year, but the plan's then going to take care of 80% of the remaining costs up to a maximum of $50,000 in a lifetime. That in and of itself is a pretty good little additional benefit there as far as the gap policy is concerned, right? So to be eligible for this, really, they have to have Parts A and B. They have to be over the age of 65, or if they're Medicare eligible due like to disability in a state, if they're under 65, that's going to be their requirements for eligibility. So as I mentioned before, the coverage can start the first day of the next month after they sign up. They actually also have the freedom to choose the initial day that that first premium draft date is going to come out, so they can really kind of choose the day of the month that they want that bank draft to be drawn on, which can be anywhere between the 1st and the 11th day of the month. And like I mentioned, the form of payment is done via EFT or an automatic bank draft. Now, there's 3 different ways that they can actually do the application process. You have a voice signature process, you have an e-process online, or you have a paper application. So, you can call up the telephonic enrollment department and you can actually do it over the phone. You can log on to Triad, which is the NGIH .triadtpa.com website as far as your e-signature, or you can do the paper application and then submit that via fax as well, or via online as well. As far as the states, we have your listing of states here. There is going to be 1 additional state that's going to be added on as of the 15th. It is not on the presentation as of yet, but once that state's added on, we'll actually get everybody updated on that as well too. And if you would like the plan brochure on this, I can certainly send this out to anybody who asks. That's not a problem whatsoever. And if you have any questions as far as the enrollment is concerned or any of the enrollment processes, definitely feel free to reach out to me and I can actually give you some more information on that as well too. But it's a very easy over the phone process. You obviously want to make sure that you're really kind of prepared in advance, making sure that you have all of your enrollees' information and make sure that the enrollee has their checking account information available too, so that it can really kind of go smoothly from that point. So in summary, as far as the supplement's concerned, again, it's really going to protect you from all of those out-of-pocket expenses. There are different plan options to choose from. There is a free 30-day period. So if they don't like it, there's a free 30-day period where if they just decide to cancel after that, no problem in that aspect. They would have a refund of that amount. Again, they have the flexibility to go to see any doctor or hospital that already accepts Medicare. If there are multiple individuals in their household, there is the possibility that they can get a premium discount for multiple household individuals, and guaranteed issue is available, again, starting the 1st of that following of the next month there. So some of the limitations and exclusions are put up on the screen here. I generally am not going to read these, but you can kind of take a look at that and eye those. Again, if you'd like to see the specific plan brochure, if you don't already have it, it is on the broker portal in that aspect, but I can also provide that to you if you would like it. Now, if you have specific questions on that, you can reach out to member services. Now, again, this member services number is just for the supplemental side of things, for the NatGen side. You can always reach out to their member services. We have the address there. Now, the tele-underwriting phone number is listed as well as claims. And if you have any questions on the Triad site or the member and agency services number, there is the 801 number down there as well too. Something to keep in mind here as a final little bullet point as far as cancellations, make sure cancellations do occur 10 days prior to their month anniversary to stop the withdrawal of the premium. Anything less than that 10 days prior, the premium's still going to be withdrawn, and then then you're going to be having that conversation of, well, when was it canceled? So if you have questions on this aspect of things, you can always also reach out to the training team, training@ngisadmin.com, for questions on the supplemental side. And for questions on the Medicare side of things, you can always reach out to medicare.gov, cms.gov. You can call Medicare directly. I am constantly on these sites. There is a plethora of information on any of these sites. So while you can always reach out to me directly, any of these sites are listed as well too. There's a lot of information available for you. And like I mentioned earlier, the URL is down there for your low income subsidy and extra help individuals. So if they do want to get some additional help through the Social Security Administration, that URL is listed. And then as far as our contact information, training@ahcpsales.com. Again, you can reach out to any of us at any time. We can answer any of the questions that you have. So I hope that everybody has a wonderful AEP.